Brooklyn Independent Television.
Hey, it's a big
But
borough.
will Brooklyn really go for
Why
it?
don't we just agree to disagree?
Yeah, that's really gonna fly in
Well, that's a
Brooklyn.
good question.
No. Listen.
That's exactly the point I wanted to make.
It started as a healthcare policy, and now the Department of Health and Human Services mandate that virtually all private health plans nationwide provide coverage for contraception has become a rallying cry against the influence of government on organized religion. This is Intersect, and today we're talking coverage for contraception. I'm joined by Holly Lawmaster of iHeartConsciousness.com and Julie Gonen, who is from the Center for Reproductive Rights. Thanks for joining us.
Thanks for having us.
So, as I alluded to just a second ago, this is an issue that's sort of spun into something that has really become a wedge issue with women seemingly on one side, lawmakers on another, and if we can triangulate that, there's also a religious aspect to it. So just to sort of give context to where we are, how do you think it's gone from a sort of mundane policy thing that's a law already in a number of states that's become a real rallying cry? Julie, you want to start?
Sure. As your question suggests, it is a little bit surprising. Contraception is a fundamental part of women's health. It's something that American women use extensively, although not as extensively actually as they probably should, given the high rate of unintended pregnancy in the United States. So it is a little bit surprising that it has become such a controversial issue. It's important to know also that the contraception rule is actually part of a much larger rule in the Affordable Care Act, the health reform bill that was passed 2 years ago, that requires health plans to cover a range of preventive services for adults and children without co-payments or cost-sharing requirements because, frankly, people just don't use preventive care as much as they should. So the idea is to remove the cost barriers to preventive care to encourage people to use those services more. So for women, prevention of unintended pregnancy is extremely important for their health. And so I think it's important to view it in the larger context of preventive health care.
So Holly, we should mention from the offset that you actually have partnered with the Archdiocese of Brooklyn, among other dioceses around the country. And as iHeart Consciousness is sort of paired with them, what brought the two of your organizations together?
Well, iHeart Conscience is actually not part of the Diocese
Right.
of Brooklyn or any Catholic affiliation, actually. It's for people that are concerned with freedom of conscience. And whether or not people agree with the morality of contraception, that's not actually the issue that is my concern and many people's concern. The issue is really freedom of conscience, is somebody telling me what to pay for something that I don't agree with. Well, on the other hand, many insurance companies today, we would like to keep it status quo. Most insurance companies do cover contraceptives, but there are options where you can opt out of that to say, well, I don't want to pay for something that goes against my conscience. And so while another person has the freedom to choose contraceptives or to choose an insurance plan that does that, to mandate that everyone choose a plan that covers contraceptives, abortion-inducing drugs, and sterilizations is something that goes against my conscience. And so because of that, I just don't think it's right for the government to tell me what I have to do with my money, that I have to cover one plan. So right now, like 9 out of 10 cover it. It's fine if another person wants to provide those things. I also think it's an important distinction. I don't see pregnancy as a disease. So when we talk about preventative health care, I don't think that that's part of health care, and therefore I shouldn't have to pay for it. And that's our only issue, is that we should just be allowed to have the option. We should have choices.
Okay, so speaking of choice, I think one of the arguments is that people who already work for an organization, they wouldn't have the sort of choice if there was someone who was their superior who said, well, my conscience doesn't allow for people who are my subordinates to have these sort of options. So is that a fair assessment of where a lot of the conflict is coming from, where people who don't necessarily have the position to say, I'm going to blanket offer this for my employees or people who work with me to have this option? Sort of one of these your rights end where my rights begin sort of arguments.
Well, Brian, I do think it is important that we, when we talk about religious liberty or rights of conscience, that we consider the rights of conscience of all, including employees and women who need these services. As you suggested, what we're concerned about is if the opponents of this rule get their way, an employer would be able to pick and choose which healthcare services his or her employees can get. And it wouldn't necessarily end at contraception. You can imagine an employer who's opposed to drinking alcohol might withhold services to treat alcohol dependency, or somebody who holds opinions against homosexuality might withhold treatment for HIV and AIDS. Healthcare is too important for employers to be able to pick and choose what their employees can have. And I think we need to bear in mind the rights, the conscience rights of individual women to choose whether or not to use contraception. Nobody's forced to use contraception. It merely is available as a covered service under the plan. And I do think it's important also to note there has been a lot of misinformation about the fact that this rule supposedly covers abortion-inducing drugs. That's absolutely false. In fact, the rule expressly says it does not cover abortion-inducing drugs. What it does cover is emergency contraception, which is a form of backup birth control that a woman can take after unprotected sex. Emergency contraception prevents a pregnancy from happening in the first place. It has no effect on an established pregnancy. The rule does not cover abortion-inducing drugs.
So are we splitting hairs, Holly, when we get to these things and talk about the other things that are introduced outside of contraception or those specific drugs?
Well, I want to stay away from actually because the issue can be turned onto contraception and abortion. I mean, you can look at the prescription of an Ella pill or a birth control pill and talk about the 3 different ways that it can work, and one of them is as an abortifacient, but that's actually not the issue. The issue is, do people, both employers and individuals, have the right to opt out of certain insurance coverages, or do they have to pay for all insurance coverages, including things that they don't believe are right, that go against their conscience? It's not a matter of we think that the government's making me take contraceptives. I understand that. But they're making me pay for contraceptives that I believe are harmful to women. And so I don't want to pay for those. And so an organization should have the ability, and individuals should have the freedom to be able to choose different health plans, which is how it is in store right now. And so all we're asking is that that would be kept, that there would be choices. And right now our choice is being taken away, and that goes against my conscience.
So we're sitting here today, and it's in these circles where we talk about this specific plan in the Health and Human Services mandate. And it's been full of old guys in suits telling people what's going to happen. So we're in a sort of unique position to have 2 women here discussing it. So just in my mind, I wonder if either of you think that this debate would be different nationally if there were more women in positions of power legislatively who talk about this and could come to some sort of compromise, because there seems to be a dearth of women's voices in real leadership positions.
I think that is true. We would certainly like to see more women in high leadership positions. Sure. But I don't think that this really breaks down to an issue of gender. Opinions don't necessarily break along gender lines on this. The opinion of the medical establishment is clear that contraception is essential for women's health. And no, nobody's defining pregnancy as a disease, but it would be difficult to deny that pregnancy is something for which women will need medical care, whether they decide to carry the pregnancy to term or not. So prevention of unintended pregnancy is definitely a health concern for women. And that's why, again, it needs to be viewed in the broader context of preventive health care.
Well, I would counter that respectfully by saying, well, what about the women who are infertile, have infertility problems, and are trying to get pregnant? You're right, there's a bunch of men in suits talking about women's issues and speaking on behalf of all women, and the reality is many women aren't included in that equation. And so that's not right. And why wouldn't we say, well, we have to cover, all insurance plans have to cover women who are suffering from infertility so that they could help to get pregnant? Why aren't we covering a lot of other things? The only thing that this mandate is covering that's new is contraceptives. And so that's also an issue. Anytime one person says, I'm going to speak on behalf of all women, my ears prick up. I say, really? I don't think that's quite fair.
Yeah, I agree. I'm wholeheartedly there with you. So one thing that's also seems to have happened is that this issue, like we spoke a second ago, has become clouded, where we seem to always get mired in a sort of anti-abortion or pro-life stance when we're really talking about contraception, and we've lost a lot of the speaking space around this issue because of these camps, I guess, being drawn along the lines of pro-life versus pro-choice.
Well, I would even say that it's not so much about abortion, pro-life, pro-choice, or even contraception. It's about freedom of conscience. It's about the government telling me how I have to spend my money. And that's a little big brother, and I really want to protect the freedom. I mean, it's our First Amendment rights is what it comes down to that are really being infringed upon by this mandate. And so it's unfair. The other thing is that it's been spoken of that there's an exception for religious organizations, and so at first I thought, well, that's great. You know, religious organizations are exempt. That's freedom of conscience right there. That's perfect. But the problem is that the definition of a religious organization is a strangling definition that almost all religious organizations cannot fit into. Namely, a religious organization is one that only serves people of its own faith, and that service necessarily is involved in transmitting their faith to the people they're serving. So for instance, a Catholic school is not going to fit into that category because we don't only educate Catholic children.
Right.
Like that would be, for us, that goes against my very faith. Like Jesus himself would serve people of every faith.
And a Catholic hospital doesn't
and
just
a Catholic
treat
hospital, we would
people
never
wrong.
say, oh, we can't treat you because you're not Catholic, you know? So, and you know, the schools teach math, science, English, everything else. The hospitals aren't talking about our faith. We're just loving people. And so unfortunately, what this mandate will do will force all Catholic and other religious organizations that decide they cannot, according to conscience, comply with this, to not be able to provide health care to their employees, which would be wrong. And if they don't provide this type of health insurance, then they will be fined. And so what's going to happen is many organizations, hospitals, schools are going to be shut down. And we know that the reality is many faith-based organizations are a real blessing to our country, and not just to Catholics or not just to people of their own faith, but to everyone. So we just want to preserve, you know what, everybody else has the right to choose an insurance policy that will cover the things that they believe their conscience supports, and just give us the freedom to have an option to be able to spend our money elsewhere.
So you are a lawyer. What would the ramifications be of not complying with this?
Well, first of all, I think we need to clarify there is, as Holly mentioned, an exemption for houses of worship from the rule. They don't have to comply with it at all. There is going to be a further modification of the rule that was announced by the administration a few weeks ago for nonprofit employers who have religiously based objections to providing the coverage. They won't have to provide it directly. They won't have to pay for it. The insurance companies with which they contract will provide the coverage to the women who work for those employers who want it. So this was an effort by the administration, after listening to some of the concerns in the religious community, to accommodate those concerns. So religiously affiliated employers who do have religiously based objection to providing contraceptive coverage will not have to do that.
But I have to say that that is not really an exemption, or doesn't really help, because all it's saying is that now the employer will pay the insurance company, and the insurance company will pay for the things that go against our conscience. So it's just saying, you know, you're gonna pay one person to pay on my behalf, which is the same problem. So it sounds like, oh, we've made an exemption or something, but at the end of the day, you're just saying, well, instead of paying directly to this person, just pay this person and have them hand it over. And to me, that's just, I'm still an accomplice to something that goes against my conscience. So that is not really an exemption.
Well, if an organization is a public-facing institution and hires people from the general population who don't necessarily share the religious beliefs of that employer should not be able to impose their own beliefs on their employees when other similarly situated employers have to comply with this general rule that's going to apply to all employer-based health insurance. And again, we have to bear in mind the conscience rights of individual employees who need these services and should have access to them. Nobody's going to be required to use them if they choose not to, but they should be available.
But I would counter with the fact that the government is imposing their beliefs on us and forcing us to pay for something that goes against our conscience. We both agree on the issue that people should not force their conscience on other people. And that's exactly the point, that there should be options. There should be options. And even if there's an individual within an employee situation that wants to pay a higher premium and wants to say, hey, I would like my insurance to cover this, that's great. They should be able to do that. But there should be an option. And right now, there are, according to this mandate, will be no options. This conscience, what the government considers to be right, that you have to be able to pay for these things, is being imposed on me as an individual and on literally thousands and thousands of employers and individuals, and it's not right.
So
it's not
people
constitutional.
who would support your point of view would even think that that compromise isn't much of a compromise position, even if the organization itself wasn't mandated to have to provide these services to their female employees, because they feel like the resource pool that they'd be paid from is still coming from their money, so they would rather not see their dollars going towards something that they don't support.
Well, their dollars won't be going toward it. That's what the rule says.
No,
So
their
where's that
dollars
money
will be
gonna
going
come
to
from?
the dollars will be going to the insurance company, and the insurance
which
company will
later
be paying
pays.
it, which is at the end of the day the same thing. I'm just asking you, could you sign the bill? Can I give you money and you give it to this for something that goes against my conscience? And that's not right.
The insurance companies are going to have to pay for the cost of this benefit. The employer will not have to pay for it. And part of the reason why you're not hearing a lot of objection from the insurance industry is that they know that it's actually it's cost neutral, because unintended pregnancies are expensive. So the insurance company is going to provide it, the employer won't have to pay for it, and the employee won't have to pay for it. The insurance company is going to provide it. No dollars from the religiously objecting employer are going to be going to contraceptive coverage.
I'm sorry, that is not true. There is no such thing as a free lunch. We just say, oh, well, the insurance company is going to pay for it. Where did the insurance company get the money? Somebody pays for it. The insurance company gets the money from the employer, who buys the policy on behalf of their employees, and then the insurance company pays it. So it's just me handing somebody money and asking them to pay for something that I don't agree with. And I'm being forced to do that. So to say, well, you're not paying for it, the insurance company is, it's like, but I'm paying the insurance company, so this is a moot point.
So how much do we know then? I'm thinking in this very studio a few weeks ago, we had a meeting where we switched our insurance providers here at BRIC on March 1st, and we had a meeting and everyone talked about the insurance things. And I'm sitting here and I heard about the women visits that my female colleagues are going to get, 2 visits to the OBGYN twice a year they get to go. That's covered under our coverage. And that's not something that I'm going to partake in. I wouldn't begrudge them the right to go to their OBGYN. But I wonder if there's a sort of a la carte thing that we even know, if organization A doesn't support contraceptive precautions for their female employees versus company B. Is there a sort of savings or a picking and choosing to know who's paying for what?
Well, actually, you don't, and that's you have to kind of understand how health insurance works. A health insurance company contracts with a number of employer customers. They get premium dollars from all of those customers, and then they pay claims out of that pool of funds. So by the reasoning that Holly was describing, an employer who didn't want to cover contraception could effectively tell an insurance company that they couldn't provide contraceptive coverage for one of their other customers, simply because some dollars from the objecting employer were in that pool of money. Yeah. That's just not how insurance works. You choose a set of services to be covered, and you pay a premium to an insurance company for those services. The rule that the administration is drafting is going to ensure that employers who have a religious objection to contraception will not have costs for that coverage reflected in what they pay to the insurance company. The insurance company will offer it to female employees at no cost, and they will do this because they know that it's going to save them money.
But again, there's a distinction that is made between a formal cooperation and something and a material cooperation. So even though if you have policy A that covers contraceptives and I have policy B that doesn't cover contraceptives, and my premium will be therefore lower, just like in car insurance. So I'm going to cover liability but not whatever, Yeah. It's true, and I understand that all money goes into a big pool. And so technically some of the little amount of my premium that's going into that may be going towards contraceptives, but I didn't formally participate in that by paying for a premium that is designated to cover contraceptives. And so it may seem like a small distinction, but I feel that I should have the right to be able to say and to not pay that extra premium to cover something that is against my conscience. And I believe that I have the right, and our First Amendment law says that we do. We have the right, and no one can tell me how to spend my money. I'm not begrudging services of other people. I know I'm not being told that I have to use something,
Right.
but I do have to pay for something, and that's not right.
So isn't there a place that women can go outside of their employers to get contraception? Is this something that should just be removed from the realm of employer-employee relations? You work for an organization that's concerned with contraceptive rights. So are we at a point in this country where there's a crisis of contraception that we have to only get it at work? Where are we in terms of the culture and providing contraception?
Well, I wouldn't say that we have a crisis of contraception. What we have is imperfect use of contraception. As you alluded to, there are community-based family planning providers who are there for people who don't have other means to access it. But it really should be part of overall healthcare. It shouldn't be carved out into sort of a separate pool of providers. And it's interesting that a lot of the people who oppose family planning services, they oppose funding those very community providers that they're now arguing people should go and get their family planning from. The reality is that almost half of pregnancies in this country are unintended. And a lot of that is due to the fact that women either can't afford contraception, they use it irregularly, or they're not using the more effective forms of contraception, which tend to be more expensive, and some of those forms require a doctor visit. The idea of this rule is to make all forms of contraception available without cost sharing, so therefore women have access to all methods, to the methods that will work best for them, and hopefully we'll be seeing our unintended pregnancy rate go down. In August of this year, women will start having access to this service without cost sharing, and I think that you're going to see a lot of folks in favor of this rule.
So to that end, Holly, we're talking about other people who provide contraception. From your movement, you speak about paying out in terms of private insurers and where the money goes and being complicit in that sort of thing. But what about the larger government responsibility and actual funding of those organizations that are outside of private businesses, such as a Planned Parenthood or other places where people have ready access to contraception that are not funded through mostly private monies?
Well, I believe that the government should give us choices. And right now the government is limiting our choice to one, which isn't a choice, and mandating that everyone choose this one plan that covers things that go against my conscience. My point is, you could even say an employer should offer different packages to its employees, and they could opt for one or the other. But right now we're just not being given a choice, which is kind of ironic.
So I know we're wrapping up now. I'd like for each of you to provide some kind of summation of how people can get in touch or be involved on either side of the issue. You want to begin, since we're starting here?
Well, sure. And there's actually a lot of people who are upset about this mandate, and it feels very un-American to have the government tell me how I have to spend my money, particularly when it goes against my conscience. And really, could be the first step. Like, if they can tell me what I can do with my money for this, then what else can they tell me to do that I have to do and I'm mandated to do? And our whole country was founded on freedom from these sorts of things. It feels, very unconstitutional. But iHeartConscience.com is just a website that is devoted to looking at our American ideals and saying we should have choices. And so there's going to be a rally on March 23rd. There's going to be a nationwide rally. There's over 60-some cities that are devoted to having groups of people get together to say, hey, this doesn't speak on behalf of all Americans. It doesn't speak on behalf of all women. And all we're asking is to be given choices.
Julie?
Sure. Well, I would say this is really an issue of women's health. Contraception is essential to women's health. This is not an issue of religious liberty. In this, I think there's a misperception that all religious organizations, religious entities, and people of faith oppose this rule, which we know is certainly not the case, particularly since the administration announced the accommodation for employers who object. Number of national religious organizations have come out and applauded the accommodation. We know that virtually all women will at some point in their lives, 99% of women will use contraception at some point in their lives. 98% of Catholic women will use contraception at some point in their lives. So we really do believe that the government is serving the interests of the people with this rule and that women will embrace it. This is also nothing new. Many states have had rules like this on the books for years, some with religious exemptions, some without. They've been upheld in the courts. So we think the administration is on firm footing and they've done the right thing for women's health.
To say something about the 99%, which comes from the Guttmacher Institute, funded by Planned Parenthood, but it also includes natural family planning as a contraceptive, which is respecting a woman's body and not using any type of medicine or anything. So that statistic is a little bit biased, in my opinion.
So we need a breakdown to find out how much of that is the rhythm method and how much of it is the
No,
pill.
this is not the rhythm method that we're talking about. It's actually a NIPR technology.
Oh, that's
and
a whole other show.
99% effective, so there we go.
Today, I'd like to thank my guests for being here. Julianna Gonen, the Policy Counsel for Federal Legislation at the Center for Reproductive Rights, and Holly Lawmaster of iHeartConscious.com. Thanks for watching Intersect, and we'll see you next time. Bye now.
Watch this and other Brooklyn Independent Television episodes online at bricartsmedia.org/BIT.